So given our recent mock survey, we've made some changes to the bag technique or updated the way we're doing our bag technique. This is going to be a video to sort of explain how we're going to do that. We would have started this with, I would have been at my trunk, I would have hand sanitized prior to putting my gloves on, and then I want to have one pad with me, my tablet in my pocket or under my arm, and then I want to have a trash bag out. So we knock on the patient's door, we go into the patient's home, we're going to put a barrier down, and we're going to put our bag on top of that barrier, and then your trash bag you're just going to kind of put just over to the side, like so. Then the first thing you're going to do is you're going to take your gloves off, and you are going to hand sanitize. Okay. Once you hand sanitize, you will now go into your bag, grab an extra 3 barriers, zip your bag back up. You're going to set up your bag, you're going to set up one barrier on one side. I would suggest that the side that you have your trash bag on, that be your dirty side. Then you're going to have a barrier which we're going to call the clean barrier on this side. And then you're going to have a third barrier which you're just going to leave folded, and you're going to put it just on the outside of your clean barrier. Now in your pocket with your hand sanitizer, your dirty pockets, you could take out an alcohol wipe. You would open it up, you would take your tablet, this, you drop in there, and you're going to clean your tablet upon entering the house, and you're going to put this tablet on this pad that you kept folded. This is going to be your own private pad for your tablet. Then you hand sanitize again. You're going to go into the reusable equipment. You're going to grab out your reusable equipment, and you're going to zip your bag shut. Then you are going to hand sanitize again. You're going to go into your one-time use equipment. You're going to pull out your gloves, whatever else you might need for this patient visit. Then you're going to zip it shut, and you're going to hand sanitize again. So the setup of this might look a little different than what we've usually done. The difference being that now we have a clean side and a dirty side. Before, we had always taught that once you take everything out, it goes onto one pad, and that was your dirty pad. The new information that we've gotten is that once your equipment is clean and it's in your bag, when it comes out of your bag, it is still considered clean until it is used on a patient. So you've got your gloves, you've got all your stuff. This is all on your clean side. You would hand sanitize again. You would put on a set of gloves. And you would perform your patient care. So if you wanted to bring your tablet over there to it, remember your tablet is on its own little pad. One thing that the gentleman who was helping with the mock survey was saying is that we take our tablet all over the place and we put it on somebody's counter, we put it on this, we put it on that, and he said that by using a pad that's folded up, you'll always have a clean place to put your tablet on. Now, when your tablet does go over there, we do need to clean it before it goes back into your pocket or anywhere else, but to always bring a tablet with you. So if you want to bring your tablet, you can. If not, you could just leave it sitting on its pad over here. So we come over to the patient. Hi, Miss Smith. What is your name and date of birth? You know, we get all of our, do all of our stuff. Vital signs, vital signs, vital signs. Get our head to toe assessment. We complete all that. When we bring it over back to our thing, we set it now on the dirty side. The dirty side is for equipment that has been used already on the patient. Notice our gloves are still on the clean side. One of the big things that they pointed out about our bag technique is that we were commingling stuff that was clean or stuff that had been used on the patient with stuff that hadn't gone and been used by the patient yet. So for example, we had clean gloves that had not been used yet, were on the same pad with the equipment that we had already used. So they did not like that. We didn't kind of distinguish between the two, so that's why we kind of changed what we were going to do. So at this point in time, you would take off your gloves, you would hand sanitize, you would put on another set of gloves, all right, and then you would then go about cleaning your equipment. Remember, when you cleaned your equipment, I would have taken out the stuff ahead of time. When you clean your equipment, 1 alcohol wipe per piece of equipment. So clean this piece of equipment with 1 alcohol wipe. Alcohol wipe would go in the trash. This would go onto my clean side. Another alcohol wipe for this one. Alcohol in the trash. This goes here. So then you would let this dwell for the appropriate amount of time. That would be about 2 minutes, 30 seconds to 2 minutes for alcohol to completely dry. You would remove your gloves. You would hand sanitize. And then you would go into your bag and put your equipment back away. Now remember, your equipment is now cleaned and is there. You would take off this, or you would have no gloves on because you went into your bag. Then you would hand sanitize, put on a new set of gloves, which you would have here. And then with this set of gloves, you might take your tablet over there, go do your med reconciliation, look at the patient's pill bottles, make sure that you do your med reconciliation correctly with the medicines in the patient's home and everything of that nature. All right, so you would finish all that up. Remember, if you took your tablet around, when you brought your tablet back, your tablet is considered dirty at this point in time. So that would be on your dirty pad if it needs to be, or it can sit on its own pad right there. We would absolutely take an alcohol wipe before we left, clean this off, move it over to our clean side. Then once we've done that, then we would hand sanitize. Once it is dwelled appropriately, we can pick up our tablet without our gloves on, put it back in our pocket, hand sanitize one last time, put on our last set of gloves, and now we're picking everything up.